Thank you.
Okay, yes. Thank you, ma'am. A very good afternoon, all of you. On behalf of NIMA Central and NIMA OBGY Central, I welcome you all to 54 webinar. Today's topic is Ayurvedic approach in dysfunctional uterine bleeding by Dr. Amrita Mishra, ma'am. Myself, Dr. Shraddha. I am coordinate today's webinar with my coordinate Dr. Aarti Nandar. First of all, it's my great pleasure to welcome all honorable dignitaries present on this virtual dais. I welcome Dr. Kamini Damin ma'am, President NIMA OBGY Central, Dr. Priyanka Nakre ma'am, Secretary NIMA OBGY Central, Dr. Vishnu Bhavne sir, Treasurer NIMA OBGY Central, Dr. Rajesh Utane sir, Conveyor NIMA OBGY Central. Also further, I would like to welcome all office bearers of NIMA Central state bodies. I heartily welcome all the participants attending today's webinar. Welcome all. Let me brief everyone with few instructions to maintain decorum of today's lecture. Kindly register with name as written on NIMA OBGY membership registration certificates followed by NIMA OBGY registration number. Please don't hesitate to put your doubts in the chat box or you can raise your hand. All doubts will be answered at the end of session. Proceeding further, we are now virtually going to inaugurate this webinar with Dhanvantari Stavan. Everyone can fold their hands, pray and seek blessing from Lord Dhanvantari.
Dr. Shraddha, you can start your video as well.
Yes, May Lord Dhanvantari bless us all with good health, success. Now, I would like to brief everyone about NIMA OBGY agenda. NIMA OBGY, that is National Integrated Medical Association Obstetric and Gynecological Society of India, aims to impart education and supporting, protecting and character status of interested of the integrated medical profession in participants of Sriroga and Prasuti Tantra. NIMA OBGY is committed to promote services for betterment of the health of community, services for betterment of health and community, especially maternal and child health, prevention of anomalies and disease, their treatment with integrated approach of Indian medicine with modern science. 4-line brief introduction of this topic. So today's topic is dysfunctional uterine bleeding. That is, we can compare with the Ashrubdar or Rakta Pradar in Ayurveda. Menstrual cycle that are irregular in frequency, length, or excessive heavy bleeding are symptom of dysfunctional uterine bleeding. So we are here to explore that Ayurveda has too easy in the management of dysfunctional uterine bleeding. Today we are very lucky to have here with us dynamic personality and clinician Dr. Amrita Mishra ma'am. She will guide us through her novel thoughts regarding the topic. So we welcome you ma'am. We are very honored to have you with us. It's my pleasure to introduce all of you with Dr. Amrita ma'am. Amrita ma'am, she is gold medalist in her BMS. She have done her MD in Prasuti Tantra and Sri Roga from Government Ayurvedic College, Nagpur. Also, she have done her MBA in Clinical Research and Healthcare Management. Currently, she working in Associate Professor in Department of Prasuti Tantra in R.A. Poddar Hospital, Mumbai. Ma'am has total teaching experience all over 17 years. Have guided many UG, PG and PhD students till date. Ma'am has successfully treated more than 15,000 patients of gynecology by Ayurvedic treatment, and many more patients treated successfully in infertility. She is also winner of Jivika Award, Vishwa Sanman at Thailand, first faculty in the history of Ayush to receive Premier Fellowship in Education, Research, Philadelphia in Medical Education and Research. She is also working as head of Women's Cell of Vishwa Ayurveda Parishad, Maharashtra State, and she also doing work in Ayush trainer for maternal and child health care. Mike, over to you, ma'am.
Good afternoon, everyone. Hope I'm audible.
Yes, ma'am, you are.
Okay. So, at the outset, I would like to extend my gratitude towards NIMA OBGY, particularly Dr. Kamini Madam, Dr. Rajesh Utani, Dr. Priyanka Madam, Dr. Vishnu Sir, and all the authorities, and also Dr. Prajakta Patil, who is my student from Kodda, Dr. Arti Nadal, Dr. Shraddha, and everybody for being here, for giving me this opportunity and associating me in this session on dysfunctional uterine bleeding according to Ayurveda. So I think I would like to start my session. Can I share my screen, Dr. Prajakta?
Yes, ma'am.
Hope the screen is visible to all.
Yes.
So firstly, the topic of today, as we all know, is the Ayurvedic aspect of dysfunctional uterine bleeding. So we all know what dysfunctional uterine bleeding is all about. It is abnormal uterine bleeding. As far as with abnormal, we mean the duration and the amount of flow, and with if at all it is associated with symptoms and disturbing the normal routine activities of the women in the form of some clots or excessive flow or symptoms such as abdominal pain or low backache and symptoms regarding the complications when the blood flow is in excess, it leads to general debility and anemia. So the symptoms associated with that also, and all this contributes to disturbing the routine life of the women. And these days, the number of patients coming with DUB is also increasing immensely. So that is the reason why this condition holds immense importance in gynecological practice, and it needs to be dealt with extreme seriousness, and I guess it needs to be dealt with holistically as well. So there are several treatment modalities available. We all know, and we have been using also many of them. But what is the Ayurvedic answer, and what is the need of Ayurveda for the management of DOB? Because we see that there are so many complications when we use these hormonal therapies, and the chances of recurrence is also more. And when the signs and symptoms are not reduced and the blood flow is continuous, then there is a need of invasive therapy. And after invasive therapy in the form of hysterectomy, the woman is subjected to other complications as well. So if we have an answer which is safe and which increases the general health of the women and reduces the chances of invasive therapies, it is better. So that is the reason why we are looking towards Ayurveda with growth, hopes, and expectations for the management of dysfunctional uterine bleeding. So basically, the signs and symptoms of DUB revolve around the mentioning of Asrigdar and Raktapradhan in Ayurveda. So coming to today's presentation, the learning objectives or the highlights of today's session will be Asrigdar and Raktapradar concept in Ayurveda, firstly. Then how is the mention of Nirukti or Raktapradar and Asrigdar in Ayurveda, and what is its correlation with the management and the pathophysiology? In the etiology, also the referential extracts from various Sanhitas according to different acharyas, and the types and samprapti according to modern and its Ayurvedic correlations, treatment as per various Sanhitas, details of various Ayurvedic treatment modalities, And also because we cannot just have the theoretical knowledge of whatever we read or whatever we have studied. We need to have, for motivation and for our confidence, we need to have some updates about the researches and what all is being done successfully in this regard. Hence, we will be looking into the scientific updates and researches also pertaining to BUB and evidences as to what is practiced and what are the evidences uh, on the actual cases that we are getting and that we have received. So this will be the highlight or the objective of today's session. Coming to Asrikdar and Rakta Pradar is defined, as we all know, is the cyclic bleeding at normal intervals, and when it is excessive in amount. Now we cannot precisely say it is 80 ml, it is according to text, but basically we ask the patient whether the flow of bleeding is 4 pads or more, and if it is associated with symptoms, and if it is with clots, and if the duration is more than 4 to 5 days, then we usually consider this patient to be having the need to be treated. Acharya Charak said that Pradar is a disease in which blood comes in excess. And Madhava has opined Rakta when discharged in excess amount per vagina is known as Aswagya. Acharya Vagbhat opined that when blood is either during or intermenstrually it is present, then it is said to be Asrigda or Pradar or Rakta Yoni. Now, coming to the Nirukti, Asrikdar is made up of Asrik. We know that Asrik is Rakta and Raja. Dara is continuous, that is excessive flow. So, Asrik Dara is Asrik, that is continuous excessive flow of Raja, which we called as Asrikdar. So, the terms mentioned in various Sanhitas pertaining to this condition is Asrikdar according to Charak and Sushrut, and Pradara according to Acharya Charak, and also Acharya Charak in its Sutrasthan. Definition, we know that Pradiriyate iti vistarito bhavati iti pradarah asrubdiriyate yasmin iti asrubdarah. So as we have already mentioned in the previous slides, when normal menstrual pattern is altered in reference of duration and amount, color and cycle, then the condition is called as Artha Dushti. So this is the reference of Charak Chikitsasthan, wherein there is which etiologically means that excessive intake of lavan, amla, katu, vidahi, payas, dahi, guru, snigdha, and mithya ahar vihar basically. And mithya ahar vihar is a broad term. It is a broad terminology. What we need to focus and what we have seen through so many years when while taking the history of the patient is there is excess of lavan, amla, katu, vidahi, and that is the Viruddha Ahar in their diet. And particularly, I have also seen that when the patient is habituated to be taking stale food, like stale chapatis or stale food overnight, if she is having the chapatis or rice or something which is stale, then the proportion in such women of osrigdar or menorrhagia or cystic conditions like fibroid has seen to be more in amount. Sushruta Samhita says that Pittavrita Apan Vayu, Ashtang Sangraha says that is increased amount of blood. Ashtang Hriday says that Pittavrita Apan Vayu is the positive factor. And according to Madhav Nidan Bhav Prakash Yog Ratnakar, it is Viruddha Bhojan, Garbha Prapatak, Ati Maithuna, that is excessive coitus, and different conditions which cause physical and mental strain lead to this condition called Asrigda. Harita Samhita as again mentioned that milk carrying channels of infertile women are filled with vata. And Kashyap Samhita has again reiterated Pita Vrita Apan Vata and Ati Vriddhi of Rakta. So that is Ashray Sambandha he has emphasized on. So this is how the samprapti of Rakta Pradar occurs. When there is Bhidana Sevan, then that is the conditions which have been mentioned in the positive factors. It leads to Abhishandi and Pitta Prakopak, that is Ahar Vihar, it leads to Pitta Prakop. Once this Pitta gets Prakopit, it leads to Rakta Dhatu Dushti and Pitta Vrittavad. If Rakta Dhatu Dushti, then it is preceded by Prakopak Rakta Varda, Prakopa of Rakta Dhatu. And if the Pitta Vrittavad is there, then it is vitiated Vayu, which gets increased. Now this Prakupit Rakta leads to aggravated Vayu, all the two combined together. So it can be either Pitta Vritta Vata or it can be either Rakta Dhatu Dushti. In both the conditions, ultimately there is aggravation of Vayu, which holds the vitiated and Prakupit Rakta. And then there is Sthana Sanshray in the Garbhashay. And because of this Sthana Sanshray, Asrik is mixed with the amount of Dushit Rakta, and this leads to increase in the amount of asru, which leads to pitta vritta vayu, apan vayu prakop, and hence rakta pradar. That is excessive secretion of asru. So basically, we see that apan vayu, the vayu per se, and pitta prakop are predominantly the causative factors and main samprapti ghatak of this condition. So these are the references. Raktam Pramanamutasya Garbhashya Gataha Sita. So these are the shlok which explain the samprapti of Asrikdar. So samprapti can be explained as Pitta Pradhan Tridosh Dushti, that is the Ahar Vihar that we have described. This leads to Rakta Vriddhi due to Pitta Vriddhi by its Drava Gun, and hence Apan Dushti, which leads to Rajova Srotas Dushti and excessive and prolonged bleeding, which is HMB, heavy menstrual bleeding. Then if it is Vyana Vayu Dushti, then it causes alteration in the ratio of endometrial prostaglandins and disturbance in the HPO axis. Now here we see that Rakta Vriddhi due to Pitta Vriddhi by its Drava Gun, if it happens, this also leads to alteration in the ratio of endometrial prostaglandins and disturbance in HPO axis, which in turn leads to, so this along with Rajova Srotodishti leads to excessive and prolonged bleeding. Now, if it is Pitta Dushti, then there is disturbance in the endometrial blood vessels and capillaries, which leads to excessive prolonged bleeding. So basically, we are revolving around this condition which we see, and this is what which happens as the Purva Roop. And this is the Roop Avastha which we see, and thereby the condition we get is HMB, that is heavy menstrual bleeding. So the Samprapti Ghatak of Rakta Pradar can be considered to be dosh dushya, that is vata dosh, apan and vyan vayu, dhatu, that is rasa rakta, upadhatu is raja, and dhatu mal, that is rasa mal. So other similar entities, that is the differential diagnosis, can be pittaz rajodushti, rakta yoni, asruja yoni vyapat, lohitak shara yoni vyapat, and for the management of above conditions, the expected management principles is Deepana and Stambhan Chikitsa. Sushruta Samhita says that there is, through the description of Asrukdar is very short, though the description of Asrukdar is very short, he has included even the normal scanty bleeding and intermenstrual bleeding also he has covered up. Charak Samhita, almost all the gynecological disorders characterized with menorrhagia, dysmenorrhea has been mentioned under Vinshati Yoni Vyapat, and there is elaborate description of Asrukdar here. In Kashyap Samhita, there is explanation of Shatapushpa and Shatavari Kalpa for menstrual disorders and Asrukdara along with the complications of Dushprajata. Ashtang Sangra, we see detailed classification and clinical features of Asrukdar. Because see here, it is very much important to have a knowledge about what is mentioned in Samhita. Only then we will be able to know the exact method, how we can come to the diagnosis protocol of Asrikdar or Rakta Pradar. Because what we see in routine practice is that there is we see that there is a specific treatment protocol. Everybody, whenever the patient comes to you, we see people giving them Lodra, we see them giving Ushanuk Churna, we see them giving some combinations which are available in the market without having an insight about what pathophysiologic is there in the patient. Each patient has a different pathophysiologically happening, and accordingly we are supposed to design the treatment protocol for this patient. One treatment protocol of DUB or HMB is not sufficient for every patient. Hello, is there any disturbance in audio? Okay.
No, ma'am. No.
Okay. So we need to know the exact methodology, how to reach the diagnosis and how to plan the therapy of a cerebral. Only then we can successfully treat such patients. That is why the reason I am putting forward the different aspects and different extracts from various Samhitas so as to facilitate the diagnosis and effective management of Rakta. Factors involved in pathophysiology. Dhatu involved is rasa and rakta. Digestive and metabolic fire is low. Srotasa involved channels carrying rasa rakta menstrual blood. And type of vitiation of srotasas. Because of that, there is excess flow. Organs involved uterus and uterine vessels. And site of manifestation is vaginal bleeding. So this is how there is pathogenesis occurs. So we have already discussed most of the points that when we have this excessive vidahi and different aharas, viharas, which lead to vitiation of vata, pitta and kapha, then there is vitiation of tridoshas. As a result of that, there is agni mandya or agni dushti, we can say there is disturbance in the agni of the body, which may be excessive, but mostly it is mandya. And then because of Rasagni Vaishamya and Vikrut Rasadhatu is there, is formed. And this leads to Upadhatu Dushti, which is Artha. So Artha Dushti is there. And then this leads to manifestations of different causes of heavy menstrual bleeding or asrupta, because there is not a single cause or a single pathophysiology which is responsible in asrupta. So because of all these conditions, there is manifestation of different causes of asrupta, which may be in the form of fibroids, which may be in the form of endometrial hyperplasia or hormonal imbalance or some cystic lesions in the form of polyps or different conditions. So the basic pathophysiology or the purva root or the hetus are these which lead to formation of different pathophysiology, which manifest themselves as heavy menstrual bleeding. So this is again, there are different acharyas. They have described Vatas, Pittas, Kaphas and Sannipati. So depending on the conditions, depending on the guna of Vata, Pitta, Kapha and Sannipata, there are different manifestations. Okay. So this is a chart showing you at a single glance what are the causes, what are the guna of Vata, Pitta and Kapha, and how are they manifested as Rakta Prabha. The prognosis or sadhya sadhyatva, we see it in our daily practice also that all the cases of Rakta Pradha or all the cases of heavy menstrual bleeding are not completely treated, are not easily treated. There are different conditions which are easily treated, which give us good results by the time they are getting treated. And once the treatment is stopped, some of them recur, some of them don't give you any result, and you have to post them for hysterectomies. So, depending on the condition, practically we see that there are different sadhyatvas associated with a simple condition, which we say simple. It's not although very simple, but the term seems to be simple that asrubdha or it's rakta prada or it's heavy menstrual bleeding. But the sadhyatva of this condition varies according to the prakriti, according to the causative factor, and according to the intensity of the pathophysiology and the samprapti which has occurred in that particular woman. So if it is ekdoshaj asrigdhar, it can be sadhya. We see this in practical also. It's not that just theoretical. When we follow this protocol and these different references or according to different acharyas, and once we start taking the history of the patient and examining the patient according to the Shivid Pariksha and different examinations which are mentioned in Ayurveda, we can demarcate these conditions according to dosha pradhanya for sure. So if it is ek dosha, when we see one particular dosh getting dominant in the body, it is easy to treat that patient relatively. If it is a combination of three doshas which have resulted in getting vitiated, then it is asadhya. Because when we treat one patient, the chances of other dosha getting vitiated is more. Because according to the principle of Samanya Vishesh Siddhant, Sarvada Sarva Bhavanam Samanya Vriddhi Karanam, Bhasetu Visheshascha Pravritti Saman.
So, according to this, we see that there are different uh, sadhyatvas of this condition. So the female body is having following features as considers are asadhya. So when we consider this as asadhya, if it is atyadik rajastrava. So in practically also we know that if the flow is more, if it is heavy, it usually doesn't get, it is not getting controlled with any other therapy or protocol, then the condition is considered as atyadik, and then it is asadhya. And Trishna. So these are the symptoms which of complications of probably asarugdar, that is Trishna, Daha, Jwara, Shina Raktata, that is anemia, Daurbalya. So these are the complications of excessive blood flow. Once we see this condition, we know that it is asadhya. Asadhya meaning it may be not sufficient for the oral therapies or for the normal treatment protocol, and the patient may require intervention. Sometimes we see these conditions in other conditions also, like if the patient is having tertiary complications such as CA and other conditions wherein we do see excessive bleeding, then also we see these conditions, and there also we can consider it to be asadhya. Upadrava, that is the complications according to Sushrut, it is Daurbalya, Brahmo, Murcha, same whatever I have mentioned in the previous slide while describing the previous slide. These are the conditions, or these are the signs, symptoms which we see as the complications of excessive blood loss, or as a result of some conditions which are of more serious conditions such as CA or other conditions which lead to which manifest themselves as heavy menstrual bleeding. So management principles or the chikitsa of asrigdar can be, this is mentioned by in Charak Sanhita, that whatever management is mentioned for that particular yoni vyapar, one is supposed to follow that particular management protocol for that respective type of asrigdar. So according to Acharya Charak and Bhagbhata, it should be treated in line with Raktatisar, Raktarsha. So there are different conditions wherein there is blood loss. So when in short, he is mentioning the use of Rakta Stambhak Dravya. So the chikitsa which is mentioned in these conditions can be implemented in the condition of asrigdar also. Charaka explained the treatment like Rakta Yoni, that is Rakta Sthapan Aushadhi, giving the consideration to the association of doshas. Treatment on the line of Adhog Rakta Pitta is to be applied, and use of Basti is beneficial. These are the treatment modalities which are given by Acharya Charak. And Virechan is indicated in all types of Artha Vikaras, including Rakta Pradha. But this Virechan need not be given during the active blood flow period. It can be given in between when the blood has stopped, bleeding is stopped, and the patient is indicated. We know that what are Arha and Anharha. So what are the patients which can be given Virechan, and what are the patients which are not recommended for Virechan? After considering those conditions, we can post the patient for Virechan also. Steps in the management are Sandhana Karma, that is the healing procedure, Skandana Karma for coagulation and stoppage of excessive bleeding, and Deepana Chikitsa for Ampachan. So this is the reference Agni Sandipanartha cha Rakta Sangrahya cha Doshanam Pachanartha cha Param Tiktai Rupachare, that is Tikta Rasa, should be given predominantly, or the medicines which have Tikta Rasa as Pradhan Dravya can be given, because Tikta Rasa is Deepan also, and it is Sangrahan also. So it facilitates Deepan as well as stoppage of excessive blood, controls heavy bleeding also. This is some other yoga which are given here, and also there are different here also, including this Tandulodak is given as what we say that Anupan Dravya. So there are different combinations which are given in according to Charak for the management of Rakta Pradha. So Ayurvedic management of DUB, we can like plan it in such a way that firstly we can go for Ayurvedic therapy, which we will be discussing in detail. Then surgical intervention can be prevented if it is given promptly, appropriately, using the condition and the proper diagnostic tests which are mentioned in Ayurveda, including different parikshan. Then surgical intervention can be prevented, and the Type of therapy which is advocated is Shodhan and Shaman Chikitsa. So drugs for external or local use, Vyagra Nakhi. Vyagra Nakhi is given as it has reference in several texts, which is situated in the northern direction. We know this, and it is said to be having a prabhav, that rasa, guna, virya, vipak, and prabhav. The medicine can have its action in 5 ways according to Ayurveda. So this is the prabhav chikitsa which is mentioned. According, other than that, there is Nasya and Abhyanga of Shatapushpa oil, Uttar Basti with Ashok Grit, Niruha Basti by Chandanadi and Rasanadi. Then Anuvasan Basti by, that is Madhukadi Basti, Asthapan Basti using Kushadi, Lodradi, Rasnadi, and Mustadi, Yapan Basti. So drugs for internal use is Rasaushadhi. Now we will see in different categories. We have different categories of drugs. So category wise, we will see what are the drugs which can be given, which are useful and which are effective in the management of Asrikdar. So Pradara Ripuras, these are the Rasaushadhis, Bolbarpati, Jahar Mohra Pishti, Kamdudharas, Mukta Shukti, Sudshekar, Bolbadharas, and Pradarantakras. Kwathakalpa or decoctions which can be given and which are really found beneficial in our practice also is Darvyadi Kwat, prepared from Pushpa of Dhaiti and cooked for 3 days, cures Asrukdar. Then Nyagroda Adi Kashai, Bhadra Nimba Kulatha Kwat, we are using this for Basti. Arishta and Asav Kalpas, Lodrasav, Ashokarisht, Manjishtadi and Mahamanjishtadi Kwat, Hadirarisht and Vasarisht. Avleha Kalpana in the form of Khanda Kushmanda Avleha, then Brihat Kushmanda Avleha, Jirak Avleha, and Bilva Avleha are very effective. Now, this also cannot, each and every drug cannot be given to all the patients. Now, if it is, we see that it is a Pitta Pradhan Prakriti, wherein there is the patient, Prakriti, when we see the Prakriti Parikshan, we see the dominance of Pitta in such patients. Then we need to stress upon the drugs which are more into Pitta Shamak types. That is, we can more, you can use Nyagrodhadi Kashai in such patients. Mukta Shukti can be given. Then we can use Jahar Mohra Pishti in such patients. Lodrasav can be given. Khadirarishta can be given. Okay, then Jira Kavleha can be given. If there is a dual, you see that there is Vata Pitta Pradhan Dushti, then we can club it up with, say, for you can give Mukta Shukti along with Pradara Ripuras. You can use Ashokarishta also along with, you can, and we can use 2 Asavarishta in combination also. We have been using 2 Asavarishta in combination, using, say, for 2 teaspoons of both along with 4 TSF water twice a day. So this we are giving practically to the patients. Depending on the Dosh Dushya Samurchana, we are supposed to decide the combination of therapies and drugs which can be given. Shirpak Kalpana, Shirpak of Ashoka is given. Ghrita and Tel Kalpana, we are using Shita Kalyana Ghrita, Yashti Madhu Grit, Shatavari Grit, Mahatikta Grit. So this is given for Virechan also. If the patient is okay and if the patient can tolerate Virechan, we use this for Sneha Pana. Kalka and Churna Kalpana, pestled roots of Tanduliyak with honey can be given. Then Pushyanuk Churna, powder of Indrayava and sugar can be taken overnight, kept overnight, and can be given to the patient. Use of Ekal Aushadhi. Ekal Aushadhi can be given in the form of Churna also, can be given in the form of Basti also, can be given as extracts also, like Ashok, Kamal, Durvaswaras, Kutaj, Natkeshar, and Vasa. Brief review of some of the drugs in Asrukdar. For Anuvasan Basti, Madhukadi Tel, Shatapushpa Tel can be used as Anuvasan Basti. Internal medicines and kashayas are given. These kashayas which we have already seen. Darvyadi Kwat can be given. Then Pradar Har Kashay can use a combination of different drugs and give to the patient also. Vasadi Kashay, Pathya Amal Ke Adi Kashay, Vasa Kashay. Kalka and Churnas, Tanduliya Mula Kalka, Rasanjan and Laksha Churna with Ajakshir can be given. Bala Mula can be given with milk. Ushanuk Churna is very common and many people use it with Madhu and Tandulodak. But here also I would like to say that when there is Pitta Pradhan, Dushti, we see, then we should always use Tandulodak. And if it is a combination of Kapha Pitta, then you should use Madhu as Anupan. So Anupan also varies with the Prakriti, constitution and pathophysiology and the dominance of that particular dosha. One Anupan cannot be suitable to all types of patients of Asrita. Shira Prayog, then Avleha, we have already seen this in the previous slides. Now, Mahatikta Grut is absolutely very beneficial in the patients of such condition. So, Lodrasav, Avipattikar Churna and Rakta Stambhak Vati is available in the markets and it is really seen to be giving good results. So, 2 to 3 tablets can be given with water or with Tandulodak, and this has a Stambhan effect. Avipattikar, sometimes what happens with Churna, the dose which the physicians give is not the optimum dose. We see sometimes the bleeding is say for 6 to 7 pads per day. And when we are giving Pushanuk Churna as say we should not give actually in teaspoons. We should always give the churnas in gram form. Also, we should write the doses also to the patient in the prescriptions in gram form. It should never be 2 TSF, 1 TSF, 3 TSF. It should always be 5 gram, 10 gram, 15 gram, 20 gram. So if the bleeding is more, the dose can be given to up to 10 to 20 gram can be given to the patient, subject to the palatability of the patient. If the patient can take it, it is very good. Even the Kwatha and Asa Varishta, which we are given, should be in the optimum dose. You can give up to 4 TSF, that is 20 ml, up to 20 ml BD, that is 40 ml per day. Asa Varishta can be given in the patients if it required. So dose should be proper. Because if we are giving 2 tablets, say for 500 mg, we are giving twice a day, it may not be sufficient. Sometimes the patient's condition requires more. So we have to plan this therapy accordingly. Yoga Basti, Anuvasan Basti, Sahachar Tel, if it is Vata dominance and if we see Vata Pradhan Lakshan only then, otherwise we can use Pitta Shamak Dravya here. Uttar Basti, Ashokogrit Uttar Basti is really very beneficial. We have the PG project also done in RRA Uttar College here. While they have administered, she had given Uttar Basti of Ashokogrit during menses. Now, although this may sound a bit controversial, whether it can be given during menses or not, but yet the study was conducted and the patient seemed to have received good results. Nasya Durvaswaras Nasya can be given now 2 drops. So again, this drop should not be written actually. It should always be in the form of CC or ML, which can be administered. So this is Nakeshar, which is the actual Nakeshar, which can be given in Churna form. Lodratwak is useful. It is also given as Asa form and Churna form is also given. Or you can have a combination of drugs, ask the patient to prepare, or you can give the combination in the form of bharad, ask the patient to prepare a decoction or quat and then have it. This is Panchavalkal, which is used in different therapies, particularly in this condition. So what Udumbar, Parish, Ashwatha, Palash. Now, how does Ayurveda work on HMB or DUB? The Ayurvedic management principle, so it basically revolves around Tridosh, Shaman, and Rakta Pradar Chikitsa. That is, we have already seen that a Sambhan Chikitsa, Dipan Chikitsa, and Shaman Chikitsa, also Samanya Vishesh Siddhanta, is taken into account. Based on the above Siddhanta, the pathophysiology or the probable mode of action of drug can be described as. So in HMB, we see endometrial hyperplasia or adenomyosis or uterine fibroid. These are one of some causes of HMB. So this is because of dilated vessels, ectopic endocrine glands, stroma, muscular dystrophy, vascularity and then increase and hence penetrating the vessels. And here what happens? Increase uterine surface area, vascularity, and impaired hemostasis. Now, if there is this condition dilatation of blood vessels, then there is abnormal vascular morphology and increased microvascular density. And now these three in combination lead to vasoconstriction and heavy menstrual bleeding. So what does our drugs now? This is condition. This is the explanation of Lodra Jahar Mora. But whatever drugs we are using, the probable mode of action may be similar. So because of these two drugs in combination have Ruksha Laghu Gun, Pitta Shamak and Lekhan Gun. So because of Pitta Shamak and Lekhan Gun, there is a reduction in the Prakupit Pitta, normalizes Vayu and reduces the cholesterol. Here there is reduction of Saradrava Guna of Pitta, reduces the Prakupit Pitta, reduces the uterine bleeding. Now after this, because of reduced cholesterol, there is normalizes the estrogen and progesterone, which regularizes or normalizes the uterine bleeding, normalizes the HPO axis. How does normalizes the bleeding? Because of normalized Vayu. There is normalization of bleeding, and this Vayu, normal Vayu and Pitta also normalizes the HPO axis, thereby reducing the blood flow. So now what are the researches which are conducted in this regard? So researches that we see is, first we have the clinical evaluation of Kushanuk Churna and Lodrasav in Rakta Pradar. So the result that we could see here is that this Lodra and this is found to be effective in DUB, and they found that there is hemostatic action of the combination which led to reduction in Rakta Pradar. There is another study on therapeutic review of Durva with special reference to Rakta Pradar. So here they had proved that Durvadi Ghrita, Durvadi Kwa, Durvadi Tel. So they have used this and seen that there was a good result in the patients having Rakta Pradar. This is another research article on role of Shunthi Lodra. Now they have used Shunthi because Deepan is also expected in patients. So Deepan along with Stambhan Chikitsa was planned. So this is the study which was conducted in Assam, and they have seen that the combination of Shunthi and Lodra had a very good response in reducing the associated symptoms also, like Angamarda and Brahma. So this is the our particular patient. This is the actual patient of Rakta Pradar, which was in our OPD, and she had this heavy menstrual bleeding. And you can see that we have given the combination of Pushyanu, Lodra, and Nakkeshar to this patient, and advised USG also, and we got good results in this patient. There is another study on effect of Pushanuk Churna in Asruktar, and conclusion was that Pushanuk Churna is a classical Ayurvedic preparation, and drug present in this preparation has Stambhana antifungal and antibacterial properties, and it's used in different rogas with specific anupan, in which Tandulodak plays an important role and gives better. So not only the drug, but anupan also plays a pivotal role in the management of conditions. There is another study on clinical comparative study of Ashok Twak Shirpak and Virechan with Virechan, and the other group was given Ashok Twak Shirpan. So this was the study in DUB, and they have concluded that Ashok Twak Shirpan was more effective with Virechan. When it was given with Virechan, it was seen to be more effective. So this is another study which was published in March 17, a case study of Rakta Pradar. And this was in, I think, Mumbai only, under respected Mangesh Patil sir. And there he found that Ashok Valkalk Shirpas is very good Rakta Stambhak Yog for Rakta Pradar. This is my own conceptual review itself. You can see how much the world needs to know and how much the world is interested in Ayurveda. My 4 or 5 studies are published. So one of them is the Ayurvedic and Contemporary Overview. This was the preliminary study which was published. And you can see that this study, which was a conceptual study, itself had 15,943 views and around 13 to 14,000 downloads. So that is how the need of the study can be rationalized, how much the world is looking upon and what is the need for publication of our studies. So hence we need to publish whatever we are doing, whatever we are practicing. If we are getting good results, we should certainly publish them. The world needs more of this. One more study on role of Phatik Bhasma as the hemostatic drug in the management of Rakta Pradar. So here the clinical assessment was done on the basis of grading criteria of Rakta Pradar. So where they had studied the duration, pain, burning, weakness and all. And the results were statistically significant. This is another study wherein there was use of Basti Chikitsa. So Basti Chikitsa proved to be effective here. Ayurvedic management of dysfunctional uterine bleeding. Here is again a conceptual approach, not actually conceptual. They had emphasized on Panchabhotik Chikitsa, that is, they have emphasized on the different ahar vihar depending on different prakritis of the patient. And then the case study showed that the combination of lifestyle modification, diet restrictions can treat the disease. This is again some Ayurvedic formulation was used. It was a case study published. This is a case again in our OPD, 41-year-old patient. It is not ethical to write the name, hence XYZ. Complaining of heavy menstrual bleeding since 3-4 months, polymenorrhea, pain in abdomen, hyperacidity. Here you can see all Pitta Pradhan Lakshana were there. Menstrual history was also going towards Pitta Pradhan side. So treatment given was, we had gone through whatever treatment we are giving from the modern side, we should always go for the investigations, because those investigations are mandatory, because we need to be very cautious these days about what we are giving from the documentation point of view, from the legal point of view also. Hence, the proper screening and investigation should be followed, including CBC and all the routine investigations, sonography. So whatever routine investigations are required, so they should be properly followed. Also, the associated causes such as thyroid dysfunctions or hypertension or blood sugar levels or other systemic conditions should not be neglected. They should be taken into account while treating such patients. So after ruling out everything, we have given the patient Bunimbadi Quat 20 ml BD, Kamdudharas. Second follow-up, Khadir Churna was added with Tandulota and Trivrut Davleha was given. So results were very encouraging. The heavy menstrual bleeding decreased up to 3 pads per day. Cyclic duration normalized, and the endometrial thickening was also reduced. Before it was 10 millimeter, which later on came up to be 6 millimeter. This is the patient. This is another patient. The patient had come to us with same complaint. This is the same patient. Bunimbadi Quat Kamdudharas and all drugs were given to the patient. And now there was this sonography is there where you can see the dimensions of the uterus. Bulky uterus was there, and later on this bulky uterus was not there. There was only uterine fibroid. Uterine fibroid, I would like to say that statistically we could not prove the size getting reduced, but symptomatic relief was definitely seen in the patients of uterine fibroid. Another patient coming with heavy menstrual bleeding since 1 to 2 cycles with clots, no pain in abdomen. Now this was somewhat a kafach samprapti, somewhat. So regular menses, heavy, painless, again a kafach lakshan, because if there is dominance of pain and bleeding is around, you can say 5 to 6 pads, more pain is there, then it goes towards vata side. If there is burning sort of pain, brahma, dizziness, and the patient looks like very much pale and too much of bleeding with clots, almost it is like a flow of blood, then it goes towards the pitta samprapti. If there is bleeding with clots, no pain or very less pain, less discomfort, but the bleeding is more of clots are there, then it goes towards the kafach side. So here we could see all the routine investigations were done. Khadir Churna was added with Tandulodak, and after follow-up, there were some other medicines. Panchakarma was given to such patient. Nasya was given to this patient. And later on, we saw that the symptoms were reduced. So this is another patient. This is the sonography. The same patient, Khadir Churna was given to the patient. And then there was a reduction in the signs and symptoms. So these are the sonographical reports of the patient. So thank you. This is all from my side. And I hope I was able to express my, and I was able to deliver some useful contents to you, which might be useful to you in your private practice in your clinical practice, and if your students, it will be helpful to your in your thesis and other hospital work also. So if you have any queries, I think we can proceed with the question answer sessions now.
Thank you, ma'am.
It was a wonderful one.
Thank you, ma'am, for this wonderful session. And it is always pleasure to hearing you. And I'm very proud that you presented our Poda College. So thank you, ma'am. So let's move on to question and answer series. Ma'am, we have one question. Please explain irregular shedding and irregular ripening according to Ayurveda.
Irregular shedding, we can say that whenever the term irregular comes, there is always predominance of Vata. Now, Vata alone cannot always be the Samprapti matter. When the Rakta Pradhar or when there is something related to bleeding, Vata alone, per se, if there is any condition, one of the Dhatu or one of the doshas can never be the Samprapti matter. There is always a combination. So whenever there is irregularity, you can always suspect Vata. In this condition, you can suspect Vata. Not only irregular shedding, you have to have an insight about what is the clinical picture of the patient. What is the build? What is the diet? What is the prakriti of the patient? What are the associated symptoms of the patient? Then you can plan. But Vata is always there. If there is irregular shedding, then how will you diagnose irregular shedding? You have to see and what is the pathology and what is the complication that it is leading to. According to that, you have to decide the dominance. So what was the clinical picture? If you can give me the details of such patient. There is irregular shedding. So whether that patient was having menorrhagia or clots or what was the clinical picture?
Okay, ma'am. One more question is there, DUP with
So second,
EPA.
Dr. Aarti. Yeah, your voice is quite echoing actually.
Okay, ma'am.
And one more thing, we have with us Secretary of NIMA OBGY Central, Priyanka ma'am. Ma'am, please proceed.
Yeah, it was this really wonderful. Has given a madam this explanation regarding the systemic and management. I think it must means one should have that approach properly, should learn, and practically we should implement in our daily routine practices. So the management, I thought it is really means we are daily practices. We are using these remedies, and actually we get the benefited. The only question that I want to ask that to madam that at which point or which in which circumstances that we should first give the priority for the biopsy purpose of the endometrium so that we can means differentiate the diagnosis and later on we can come to the conclusion for the medicinal management.
Yeah, so madam, when we see that the patient is having long-standing history of DUB, when she is having too much of menorrhagia, multiparity, and in such patients we can suspect there is endometrial hyperplasia. Or when we have the USG of the patient, we see that there is no uterine fibroid or any other space occupying lesion, then definitely we should go for a biopsy. And also, what we follow is whenever the patient comes with the age of 35, 40, usually you see this in adolescent age group also and in childbearing age group also. So when the patient of childbearing age group comes, we always give a priority to firstly do the pap smear of the patient. We rule out whatever pathology because we see these days we are coming up with many pathologies. So we go for the pap smear. Then we take into account different causes of menorrhagia from clinical examination, from investigation point of view. And then when we see that there is no space occupying lesion and the bleeding is profuse, then we definitely have an insight about the endometrial status of the patient. And in such patients, we go for a endometrial biopsy, but not in all the patients. Usually the patient responds when the patient comes to us in early stages. say for 1 or 2 months, she's having the complaint, she comes to us in 1 or 2 cycles, maybe she gets the relief, then usually we don't go for endometrial biopsy. But if the patient is not responding, long-standing menorrhagia, we suspect some other pathology, then in such cases, we go for endometrial biopsy of the patient.
Okay, ma'am. And ma'am, how to deal with the puberty menorrhagia, means puberty dysfunction uterine bleeding, and the premenopausal uterine bleeding, means because when we consider during the menarche, unwanted cycles are there, but still prolonged time they have to deal with such situations. So at that condition, what remedies we should use for that puberty menorrhagia?
Usually, madam, what happens, see, when we take into account the Ayurvedic perspective, we cannot actually demarcate that this is puberty menorrhagia or this is something which is seen in elderly patient or this is something. Usually, what we take into account is that Uttar Bastis cannot be given in the adolescent age group. We give Lodrasav and all the kalpa which are there, depending on the dosh dushya samurchana. Now, if there is a cyclic pattern in adolescent menorrhagia, usually there is a cyclic disturbance which is related to HPO axis. So in this patients, usually we go for a yoga basti chikitsa. Then we give drugs such as Lodrasav, Jahar Mora Pishti, Kamdudha, and all these drugs are given to such patients. Now, if I say Mahamanjishtadikvat or Khadirarist, it is given to all three age groups. It is not that this particular age group receives Lodrasav and this particular age group has more effect with Khadirarist. That's not the case. But yes, if it is this demarcation happens when there is fibroid or adenomyosis. If there is adenomyosis, which is usually seen in the elderly age group, then we see more of Shothagna dravyas are given in such patients. But if it is only puberty menorrhagia, no space occupying lesion, no adenomyosis, then we follow the same drugs like Khadirarist, Mahamanjishtadikvat, Avlehas, and all the drugs. So all the drugs can be given to all the age groups, subject to what type of dosha is predominant in that patient and what type of dosha is causing or aggravating that particular condition. Like say fibroid is there, so there is more of vata or kapha dominance. So we associate it with Gugul also. Whereas in puberty menorrhagia, we give Durva Swaras to the patient, more of oral therapies, more of Basti Chikitsas, more of Avlehas, Guti Vati, Churnas. So that is why from patient to patient, but we cannot demarcate according to Ayurveda and according to focusing on the treatment protocol, we cannot demarcate as to what type of therapy can be given according to that particular age. But yes, Rasayana and other drugs can be given in early menopausal age group, but that is the additive part. For menorrhagia per se, what is important is to rule out the conditions such as CAs and other conditions in the elderly age group. Here, anyways, we know that it is HPO access which is getting hampered. So, Bastis, Nasyas, and oral therapies can be given in access. There, we can give the same things, but taking into account the other pathologies, they need to be ruled out. And then we can give the same therapies to that age group also. This is what we are doing in our practice.
Okay, okay, ma'am. And with in the perimenopausal, if we found there is a endometrial hyperplasia without atypia, so the line of treatment will be the same as you said.
Where in perimenopausal. In perimenopausal, madam?
Yes, ma'am. In perimenopausal.
Perimenopausal, madam, what we usually do is firstly, the protocol which we follow is the patient is coming to us complaining of heavy menstrual bleeding. First, we screen the patient. We take the complete history. Then we take the first thing we do is we do the pap smear of the patient. Once the pap smear is taken, simultaneously we start the oral therapies. And after oral therapies, if active bleeding is not there, then we start the basti to the patient. If active bleeding is there, then we focus on Stambhan Chikitsa first. We stop the bleeding of the patient as a priority, supplement with some Rasayan drugs, Shatavari and different Dadi Madi Kruta, Dadi Mavle, and different other drugs are given to the patient. Once the bleeding is stopped, start with Basti therapy. Meanwhile, the pap smear report comes. If it is normal, we continue with the same therapy. And sometimes we use the drugs that is Mahamanjishtadi, Khadirarishta, we give them also as basti, as Niruha basti. So that also gives us very good results. We prepare decoctions, Mahamanjishtadi Kashai we prepare in combination with Nimba, Khadir and all, and we use that also as Niruha basti. So in perimenopausal age group, emphasis is given on regularization of Vata because as it is elderly age group, predominance of Vata is there. So basti is given essentially after stoppage of bleeding, and then we start with the routine Stambhan Chikitsa.
Okay, nice, ma'am. Very nice explanation by Amrita, ma'am. I would like to ask the other people. So, Prajakta, Dr. Prajakta.
Yes, ma'am. We do have some questions in the chat box.
Okay.
Shall we proceed with it?
We have ma'am questions. Prajakta ma'am, can you hear me? Prajakta ma'am?
Yeah. Yes. Please proceed.
Yes. We have questions like in chat box that how to deal with intermenstrual bleeding if polyp is ruled out already.
Intermenstrual bleeding, same thing. As I said, abhi menstrual bleeding is happening in which age group? If it is in again the elderly age group, childbearing age group, firstly we should always do the pap smear as a protocol. We have to follow that. Go for the CBC of the patient, rule out and screen all the systemic conditions. In intermenstrual bleeding, you should always rule out systemic conditions. There may be thyroid dysfunctioning, there may be some other systemic condition. If nothing is there, space occupying lesion is not there, you should directly start with Basti Chikitsa. You should start with Ashoka Rishta because Ashoka Rishta plays a great role in regularizing and anuloman of Vata. So wherever there is irregularity, you should always start with Vata Chikitsa in the form of Basti, in the form of Dashmul, in the form of Ashoka Rishta because Arishta is very good in dealing with Vata and Pitta both, Ashoka Rishta particularly. So we start this therapy and then with Basti Chikitsa and with this type, now here we cannot entirely focus on Stambhan Chikitsa because if in such patients we directly go for Stambhan Dravya, it will further disturb the condition of Vata. It will aggravate because Stambhan is Pitta Pradhan. तो पित्त प्रधान द्रव्यों को अगर आप दोगे तो वायु का क्या करेगा, वो वायु को डिस्टर्ब कर देगा. तो आपको वात के लिए दीपन चिकित्सा भी देनी पड़ेगी. इसीलिए जब आप वात शामक द्रव्य देते हो जिसमें पित्त का भी कम होता है, जैसे अशोकारिष्ट जैसे द्रव्य अगर आप देते हो, अविपत्तिकर चूर्ण आप देते हो, तो ऐसी चीजें अलोंग विद बस्ती. बस्ती में भी आप कौन से द्रव्य, दशमूल देना है. इसमें आपको बहुत ज्यादा दूरवा वगैरह का उपयोग नहीं करना है क्योंकि जहाँ इरेग्युलर है वहां पे आपको वायु को ट्रीट करना है. आवृत्तवात का यहाँ पे प्रकरण आ जाता है. तो इसलिए इरेग्युलरिटी है, स्पेस ऑक्यूपाइंग लीजन नहीं है, सिस्टेमिक कंडीशन नहीं है, तो आपको पहले बस्ती स्टार्ट करना है, अशोकारिष्ट देना है, पित्त और वात को कम करने वाले जो ड्रग्स का फॉर्मुलेशन है वो आपको इसमें देना पड़ेगा.
Thank you, ma'am. We have another question. Like, what's the approach in case of
Aarti,
endometrial
Dr. Aarti,
hyperplasia? Yes,
Dr. Aarti,
yes, ma'am.
Madam
Yes,
has one surprise questions for all. I think let Madam to explain regarding that question and means, give them a challenging MCQ first, and we will continue with the question and answering again.
Yes.
okay,
Yes, so this
okay.
is a surprise question, and the condition is that as soon as this question flashes, the entire audience is requested to give the answer for that on my WhatsApp number, and whoever gives me the answer first will get a surprise gift from NIMA OBGY Society. So this is the question. Madam, can I flash the question?
Yes, ma'am, please.
Yes. So this is the question. Kindly give me the reference of Pradaripurus, which was already mentioned in my presentation as one of the drugs for Asrigdar and heavy menstrual bleeding. So whoever gives me the answer first will get the prize. For those who don't have my WhatsApp number, you can note it down: 9823 171494. 9823 171494. Yes. So we can proceed with questions if at all.
Yes, ma'am. So we have another question like, what's the approach in case of endometrial hyperplasia?
Endometrial hyperplasia में here there is always a scope of biopsy first, endometrial biopsy. After you need to do the CBC and everything, and have the condition of the patient. Any systemic condition is there. After controlling and ruling out all the things, we can have endometrial biopsy. And meanwhile, therapy wise, what is the clinical picture of the patient? See, in Ayurveda, we cannot always focus on the objectivity or the objective criteria. We have to get the entire holistic approach of the patient or the condition of the patient. So if endometrial hyperplasia is associated with heavy menstrual bleeding, then what is the duration of menses? Is it associated with clots? There are clots. How much of the bleeding is there? And then mostly we focus on Rakta Stambhan Chikitsa here. So it will be in the form of Khadir Arishta, Khadiradi Vati. Then we can also give Nyagrodhadi Kwat to such patients. So there will be Basti, and there may be scope of Uttar Basti if it is a childbearing age group. Then we can also plan for Uttar Basti in such patients.
Okay, ma'am. Thank you, ma'am. I have one question, ma'am. You just said like Lodraso can be used in this Ashugdar if the patient is diabetic. So can we use this Lodraso even though it's coming in Prameha Adhikar? So can we suggest
Usually,
them or give them?
usually, Dr. Aarti, we don't give Asa Varishta to such patients because, according to modern protocol and whatever studies we have gone through, they are not known to be absolutely sugar free. So there are when we have other treatment options available. I believe in why to take unnecessary risk in the patients. If we have other options of Lodra, other options of Nakkeshar in the form of Quath, you can give Quath to such patients. You can prepare a decoction in the form of Quatha or Churna or tablets also. Different tablets, very good tablets are there in the market these days. So such preparations you should always prefer in diabetic patients rather than going for Asavarish.
Okay, ma'am. Thank you, ma'am. One more question like, can Nasya and Basti be administered together for these patients? Or like how?
Together per se, we cannot say at the same time you cannot give, but in one cycle you can give. In the same cycle, you should always first go for Basti, not Nasya. Because with Basti, we plan for having Anuloman Gati of Vayu. If we don't give Basti and directly go for Nasya, there is a risk of Pratilom Gati of Vayu, and it may further aggravate or HPO axis disproportion. So that is why we should first go for Basti because Basti is the main sthan. You can know that Basti Chikitsa is the main Chikitsa, or it is said that Adi Chikitsa of Vata. You should always go for Anuloman first, Vatanuloman first taken care of. Then, after completion of that Basti, you can go for Nasya. It can be given in the same cycle, but not at the same time.
Okay, ma'am. Thank you so much, ma'am. It's again always pleasure to hear you, and I'm very proud that you are representing like our Poda College in this like NIMA OBGY. So thank you, ma'am. So on behalf of NIMA OBGY Society, I would like to express my gratitude to NIMA OBGY Society Central Office BRS, Dr. Kamini Timam ma'am, Dr. Priyanka Nakade ma'am, Dr. Vishnu Bhavne sir, and Dr. Rajesh Uttani sir for their guidance and support to conduct today's webinar. I would also like to extend my thanks, my gratitude to our eminent speaker, Dr. Amruta Mishra ma'am, who took time from their busy schedule and delivered very knowledgeable and wonderful session with us. Thanks to all Lima OBGY office bearers. I would also like to thank Dr. Girish Daga sir and Dr. Prajakta Patil ma'am for all the help and guidance for the technical support. Last but not the least, I would like to thank from bottom of my heart to all the delegates for their participation. Without all of you, this webinar would not have been possible and successful. Thank you for all attending and hope you have all learned and gained immense knowledge from today's speaker. Wish you all a wonderful evening ahead. Now, with due permission of all the dignitaries, I am concluding today's webinar. So, thank you so much.
Thank you, ma'am. It feels so
Thank you so much,
nostalgic to
ma'am.
hear.
Yes, Amruta ma'am, we would like to thank, and really we have a very good session today's,
and explaining each and every point regarding the Ayurvedic management of dysfunctional uterine bleeding. Hope you all enjoyed a lot. And thank you so much, ma'am, once again.
Good evening, ma'am. Amrita, ma'am, you're muted. Please unmute yourself, ma'am. We cannot hear you.
Yes. So, firstly, thank you very much, Dr. Priyanka, madam, for this opportunity. It is always a pleasure to be associated with you. Dr. Kamini Dhiman, madam, who is my mentor, and Dr. Rajesh Utane, sir, who is my senior from Amravati, Dr. Vishnu Bhavne, sir, who is my junior from Amravati, Dr. Prajakta, madam, who is from this our institute, who is my proud student, and I'm very happy for what she is doing, Dr. Prajakta, madam, and Dr. Aarti, madam, who is currently my student from Podar, and all the entire team of NIMA OBGY, who has been relentlessly working, continuously working, striving hard. Also, Dr. Archana, madam, who is again from Nagpur. We are associated in many committees together. I'm so proud that she's also doing very well. And so extremely thankful and humble gratitude towards the entire team, and would congratulate the entire team for doing a great job arranging these lectures. I know it's not very easy taking out time, arranging everything, contacting the resource persons is not a very easy job. So thank you all. I'm so happy to be with you, and immensely I'm thankful for every bit and everything. Thank you so much.
And that surprise winner will be announced by Amrita madam itself. And hope you people have understand the questions and will give a prompt answer of this question. So let's see who is the winner.
Yes. See, 1640, 1638, 1636. So I think 1636. 1636, the first answer I got was by Dr. Prajakta, madam.
Prajakta.
Ma'am, don't consider my answer. Take the second person.
I'm just giving you the stats. 36 is Dr. Prajakta. Then I think 38 is the winner. 1638. Dr. Shubhada Pote. Dr. Shubhada Pote. She is the winner. She was just 1 minute behind Dr. Prajakta.
Okay.
Congratulations
to both of you.
Thank you, ma'am.
Thank you, ma'am.
Congratulations.
Okay.
I forgot that it's not for me actually. I just messaged in enthusiasm actually.
No, but it's fine. And you both will get the prizes. Don't worry, dear.
No, that's okay, ma'am.
Shubhada madam and Prajakta ma'am, congratulations to both of you. Extremely good job by all of you, and for this interesting lecture. I would like to thank a lot Dr. Amrita Mishra ma'am taking out time from her busy schedules, and actually the talking about her is like her nature is so friendly. We have made since last two Sushruti, and found that she is extremely down to earth, and with this knowledge, even with having such a knowledge inside, she is really very good to all of us, and considering the juniors we are, but still thank you so much, ma'am. Thank you so much. Dr. Prajakta?
Yes, ma'am. Ma'am, we are not able to hear, ma'am. I think we'll end the meeting now. Thank you so much for everyone attending today's webinar. We will now end the meeting. Hope you have a good evening. Thank you.
Thank you so much. Thank you.